Hello, it's Dr. Haddad, the Chief of Staff of Water Health. Hope you're doing well. I'd like to give you a bit of an update about the status of our clinical services as of today, October 20th. So far, so good. We've had a good summer. We were able to reestablish our services sometime by the end of July. So we're back to basically pre-COVID levels. We still have a backlog that we're chipping away at. I don't expect us to completely catch up on the backlog that was created by the pandemic back in March and April until probably sometime in March of 2021, but nevertheless, we've made a good headway so far. We haven't had any COVID patients for about 4 months or so. We had one recently, but currently we don't have any COVID patients at the hospital. As you know, the prevalence in the community has been low. We've noticed a slight increase in the number of cases from last week, 2 up to 11 now. But nevertheless, compared to the rest of the province, we're still in a good place, in a good spot. We have roughly about 9 cases of COVID per 100,000 population, compared to the provincial average of 38. So that's giving us a bit of a breathing room to continue our clinical services at full speed ahead and continue to try to catch up on the backlog. Our strategic goal is to do our best to maintain our clinical services as much as possible, while keep an eye out for the second wave of COVID that hopefully would not be as bad as March and April, but we have to maintain our vigilance and preparedness as we can't predict the future. We've implemented a lot of protocols for a second pandemic or second wave of the pandemic, and we are ready. From a clinical standpoint, the best defense for COVID disease continues to be basic public health measures to avoid getting it in the first place. We don't have a cure for COVID yet. I know there's a lot of work being done to develop a vaccine, and there's a lot of different vaccines in the pipeline, but none of it is ready yet for prime time, basically, for clinical applications. Hopefully next year in 2021, but we will continue to keep an eye on it. From therapeutics, the only agents that have been shown to reduce mortality from COVID disease has been steroids that have been shown to reduce mortality by about 20%. So 1 in 5 would benefit from it. So definitely not a cure. Not everyone would benefit from it, but it's at least the only agent that has shown some survival benefit. There's been a lot of work on a variety of agents. The latest study published last week, actually, by the WHO, showed that remdesivir, that you might have heard about, does reduce the amount of symptoms or the days of symptoms, but unfortunately it does not improve survival. So that was a bit of an unfortunate finding. There's also a lot of different agents being tested, including anti-inflammatories, anti-malarials, etc. All of them so far have not been as promising. But we'll continue to monitor for any developments on that front. So again, as much as you can, just follow public health measures. Please avoid large crowds, large social gatherings. Stay 2 meters apart from people outside of your household. Frequent hand washings, and use masks when you go indoors into public places. COVID basically travels by respiratory droplets, and if we can break that transmission, then we will reduce the chance of spread. And hopefully we'll keep the prevalence low in our community anyways. Please stay tuned to any changes in our situation at the hospital or the county. So there's the public health maintains their website, and the hospital also, we continue to update you on any changes in our clinical services, whether it's by Twitter, Facebook, or the hospital website, plus videos off and on. So I hope you stay safe this fall and winter. We will continue our best. We will do our best to maintain our services as much as we can, recognizing that we have to be fair to all patients, both COVID patients and non-COVID patients. And if we have any upsurge locally, then we're prepared for it as well. And hopefully we don't have to slow down other clinical services, albeit we might have to. But that depends on what happens over the next few months. Thank you again for your perseverance and patience and help. And please stay safe, and thank you.